Welcome back. We're again on chronic illness, and then we'll continue with pain, and of course they go together. We finished up that lecture 1 of module 3 relating to caregivers and some of the issues and problems that caregivers have in doing their help with their loved ones and so forth. And then we shifted into this idea about chronic illness or injury and the self. And the self is really just who we are. It's that kind of inner core of what makes us unique as for each human being. And importantly, chronic illness can impact all these different aspects of the self. And there's, of course, different ways to do this, but there's the physical self, the achieving self, the social self, and the private self. And all of these, of course, are probably somewhat artificially fragmented here, but you get the idea in terms of a chronic illness such as cancer or an autoimmune condition or cardiovascular disease or a stroke. You can see how that illness can impact the very core of individuals. And again, some of these individuals you may be working with, so you need to be in tune that these people are struggling probably with various aspects of all 4 of these in terms of the physical self, your body image, if you've lost weight because of treatment or you lose hair. These are very significant in terms of how one views the body. The achieving self, if you don't have the energy, for example, if you have clinical depression or migraines or diabetes, for example, you just can't do what you used to do, and then people can get mad or angry or frustrated or so forth. And you may have had grandparents or older folks who you may know where you go, wow, they're kind of a little bit angry at the world. Well, it's possible that they may have a chronic condition which influences that. And of course the social self, it definitely impacts people who are around you, your loved ones. If you're now functioning at a different wavelength and so forth, it's going to impact the social. And the one thing that does happen to people is that with chronic conditions, they do tend to want to withdraw from social situations, either because they don't want people seeing them how they are in this kind of new way and so forth. So very significant. And then of course the private self. You may have dreams about traveling or doing something else with your life, and because of a chronic condition you may be unable to do that. So I don't want to be too melodramatic here, but the dreams you have for your life and for who you want to be may not be able to come true, and you have to kind of shift gears. I was just watching the other day, quick aside, about a surfboarder, Kevin Pierce, I believe. It was like a documentary on ESPN maybe or HBO, and he had a major traumatic injury and kept thinking that he could go back to surfboarding, on the snow, and ultimately he just couldn't. And the documentary was about his struggles with his old identity and now his new identity. And of course that was a fairly dramatic change, right, in terms of traumatic brain injury. But I highly recommend it if you can find it, in terms of the dreams can change. So just again, something to keep in mind, even for your own family, in terms of if you have people who have chronic conditions or people who you'll be treating. Now on the other hand, at times there can be some really good stuff that comes out of chronic illness for people and for people around them. Some people experience what you would call a transcendence, just a new way of viewing themselves in the world, which totally changes their outlook on life and kind of life goals that they may have. So I don't want to make this all gloom and doom, because there are some positive things that can occur from chronic conditions. You get to reappraise your life. You get to find new meaning perhaps in that chronic illness. Some people say they're glad they got the chronic illness. I don't go as far as saying that in terms of Sjogren's, but a lot of that depends on your views of life before the illness. But some people do change views, and one of the videos that's up, there's a number of videos up on resources, of course, in all of these modules, but Steve Gleason, a former NFL player with the New Orleans Saints who has ALS, Lou Gehrig's disease, very good documentary on kind of how he wants to leave a legacy behind for his wife and his children and others who are struggling with this disease. So there are good things that can come from chronic illness, but it is tricky. Now, how do people cope? There's varying ways, but the two primary ways, of course, from the literature or from your reading, I believe reading number 6, there's avoidant coping and active coping. In general, not to be too black and white here, but avoidant coping typically in the long term is not very good. Active coping, far more effective. Avoidant coping, you just don't end up doing the things you have to do to take care of business, if you know what I mean. I mean, you keep believing that you don't have this condition, or you try to keep doing the things you normally used to do, and you can't. So people kind of have this cognitive escape or this behavioral escape. In the short term, sometimes that is effective, but the literature basically says in the long term, avoidant coping, not too effective. Active coping, what they find is it's better to kind of invite this condition, this illness into your life. Not that you don't battle to kind of overcome, but there comes a point where you may need to embrace and then do the things that will help you cope to reduce or control the symptoms. So you get social support. You don't withdraw, but you actually seek out social support. You have this positive focus. I came out better than before. So the problem is that if you do have a chronic condition, it's very challenging to use active coping. So that's where there's a whole new area opening up of people who, health psychologists who help people with illness really actively cope. There's all kinds of factors that influence coping. Your beliefs about the illness, denial may lead to unhealthy behaviors. Embracing the chronic illness as part of one's life could lead to better health. So again, if you've got loved ones, if you yourself develop a chronic condition of some kind, it's best to embrace rather than to kind of fight it. And I know this seems kind of un-American, and I'm not saying you don't fight to become healthy or to live, but at some point, depending on the illness, of course, this active coping is a little bit better than the avoidant coping. But I will say that how people respond to and cope with illness is a very complex psychological and social process. You've got to take into account the client's views and beliefs, and if you're in physical therapy or helping with physician's assistant or occupational therapy, you're going to need to really kind of look at each individual. So avoidant coping, active coping, you're going to have an assignment or a learning activity with Christina and Sarah, 2 individuals who have autoimmune conditions, and you're going to do a little reading on that. So that should help you better understand kind of this ways of coping. And in that article, they'll talk about the John Wayne. In that assignment, they'll talk about the John Wayne response and the suffering response. And your job will be to get in there and kind of understand what the article is talking about in terms of a John Wayne way of coping and a suffering way of coping. And the point is that I give you Sarah and Christina 2 different ways in which they handle their autoimmune conditions, because that's real life. That's what's going to happen. Not everyone's going to be the rah-rah, we can overcome type of mentality. Some people will take on more of this suffering idea. And it kind of relates to this idea of illness being visible or invisible. And again, I don't want to give you too much here, but a lot of this in these lecture notes, and you can maybe come back to this after you do that learning activity, kind of gives you a better idea of what people are grappling with and how we as health professionals may need to approach individuals, not judging them if they aren't fighting as much as we think they should, but trying to understand where they're coming from. So this idea of not judging, don't judge, is a very important one, and you'll experience that, I think, when you read and do the learning activity on Christina and Sarah. And then lastly, you'll also look at David Oliver. He's an individual who has cancer, and he's been vlogging for several years now. He's got about 25 vlogs that you can look at. And so I think these learning activities, Christina and Sarah and David Oliver, will be good ones for you. So that's the section on chronic illness of this part of Module 3. And of course, we're getting into the next issue, which is the management of pain and discomfort. And again, as I talked about, pain and chronic illness, of course, go together, but pain is been getting a lot of attention lately. We're talking a real significant amount of attention in terms of articles in newspapers. Institute of Medicine did a big thing on pain, and so we need to kind of investigate this a little bit. I probably won't have enough time in this to do finish up this section. We'll probably have to do one more lecture, but just in kind of the overview, reading 7 is the reading, the management of pain and discomfort, and chronic illness, chronic pain, chronic stress, as you'll see from Module 5 or Section 5, they're all interconnected: stress, pain, illness, and so forth. And again, relates to the theme of this biopsychosocial. Quality of life was kind of a biopsychosocial. Pain is a biopsychosocial experience. You're getting the idea that health psychology adds kind of this holistic piece to the human being, which has been missing for a lot of years in medicine and in healthcare. So if you look at, in terms of just an overview of pain, pain is important. The numbers are staggering. I mean, the numbers vary based on the reading or a video from the Institute of Medicine, for example, but about 116 million American adults struggle or seek help because of pain. And again, billions of dollars annually just on pain alone. One of the significant issues is that typically patients who go to see doctors or pain experts, the patient believes the pain is the problem, and the provider kind of believes that pain is the symptom of underlying problems. This gets tricky in terms of communicating and treating chronic pain. I highly recommend that you go and watch the Institute of Medicine's 2010 report on relieving pain. It's on resources. It's a longer video, but if you really want to know a little bit more about the expert, the latest of where we are with pain, I would go there. The reason I say to go watch that report from the Institute of Medicine, as you can see from some of their recommendations that came from this, a need for interdisciplinary perspective. Given chronic pain's diverse effects, interdisciplinary assessment and treatment may produce the best results for people with the most severe and persistent pain problems. So you can see how they're even taking more of a holistic perspective on managing one's pain. What kinds of pain do people experience most frequently? Well, you got back pain, arthritis, headaches. Millions of people are affected by these conditions, and of course many others. And I think I'll stop here, because when I get back, we'll get into the meaning of pain, and that will require one story, which takes a little bit longer than the time I've got allotted here for this lecture number 2 on Module 3. So I'll stop here. We basically did a lot with chronic illness, and then we moved into understanding chronic pain and how it's typically treated.